All right, so when thinking about Josh's case, there's a couple things that stood out to me. So I'm only going to highlight the things that I think would be most important to focus on in maybe these first initial sessions. So Josh just recently got out of the hospital for a manic episode. And so I would first want to create a sense of safety and trust between us, especially knowing that his ex-wife was the one that called and he didn't willingly check himself in. There can be some broken trust. So just making sure that sense of safety and trust is established in the beginning, considering that episode might have been really traumatic for him and there might be some shame and guilt associated with that as well. Doing the best I can to normalize that experience for him, relieving some of that guilt about the most recent episode would be something that I would consider. When you consider his familiar relationships, his ex-wife and his daughter are two people that are really important in his life. And then some cultural considerations would be he's a 45 white male, a successful working man in his community. So considering maybe in his generation and in his community, there might be some stigmas around men with mental health disorders, especially with his diagnosis of bipolar 1. That can be a heavier diagnosis to diagnose someone with. So just considering those, those stigmas around this diagnosis, especially for a man of his age, and then also considering the stigma around medicine. Also, again, normalizing that experience. It's normal for people not to want to have to rely on meds, but again, explaining, maybe providing some psychoeducation around bipolar and explaining, again, normalizing that there shouldn't be shame and guilt around this. It's a chemical imbalance, and then the meds are there to help and support him. So maybe some psychoeducation around meds and maybe having a safety plan around when he's considering getting off of his meds, maybe having a plan in place where he's maybe reaching out to his provider first. Considering the wave that bipolar can go in, it's important to consider that his depression episode might be coming up, and so I would also create maybe a safety plan, or at least do suicide screening and be expecting these symptoms of depression. So I would maybe do suicide screening. I also would maybe create a safety plan for money. Maybe that would be, maybe not this initial session, but just looking at the treatment plan farther down the road, I would look into maybe, maybe that's giving a certain amount of money to a trusted person. So he's not losing all of his access and his control over his money, but maybe giving a large portion or a chunk to a trusted friend or family member that can hold on to it. So even if he does spend excessively, he doesn't have access to all of his money. So maybe creating a safety plan for his depression episode maybe coming up, for his money, and then the meds too. So safety plans around all three of those would be important. Again, since his ex-wife and his daughter are two people in his life that are really important to him, I think it would be important to maybe provide psychoeducation for them too. This could maybe, again, depending on what the client needs and wants, this could maybe look like just starting with the daughter or having separate sessions or together sessions, whatever the client would feel most comfortable doing. I think it'd be important to, educate the daughter and the ex-wife on what bipolar is, what it looks like, maybe some strategies to help when he is in an episode, or maybe I think what would be more important is to look for cues and signs for that buildup of that manic episode. So catching it before it's popping. So those things I think would be helpful to educate the daughter and the ex-wife about, and kind of coming at it from that point of view of like a team. This would be, I would also encourage this client to stay seeing a therapist for a long-term treatment plan. Bipolar 1 can be a disorder that is, needing that long-term care and needing frequent check-ins. So making sure that also is being taken care of. So yeah, I would definitely provide safety, relieve any guilt, normalize as much as possible, provide psychoeducation around the meds, provide psychoeducation around the need for long-term therapy, and then creating those safety plans for his money, and then also a safety plan for a potential depression episode and potential suicidal ideation. And then prioritizing his his relationship with his daughter as well.